Hi, this is Dr. Michael Weinberg. I'm Chief of Plastic Surgery at Trilling Health Partners. In the following video, we will review the following basic techniques. How to hold instruments, what the various instruments are, and how to tie some straightforward and simple sutures.
This is how you hold a needle driver with the tip of your thumb in it, your ring finger in one eye, and your index finger balancing one of the arms. This is how you hold the scissors in your ring finger with the index finger close to where the scissors cross. This is a toothed forceps. Note that I'm holding my fingers close to the flared part of the toothed forceps so that I get maximum mechanical advantage. I'd now like to show you how to hold on to a needle with your needle driver. Basically, you load it 2/3, 1/3, so 1/3 from the back of the end of the needle. I'm loading this at a little bit of an angle, obtuse angle from the tip of the needle driver because this is a little easier to get through the skin, but you can load it at 90 degrees. This is a packet with a suture. Note that it's a 4/0 suture. It has a small needle labeled a P3 needle, and it shows you that it's a cutting needle with a triangle at the tip, and it's a black monofilament suture. This is a towel clip used to clip drapes on a patient. This is a curved iris scissors used for fine dissection. This is a Stevens scissors used for dissection in hand surgery, plastic surgeons' favorite scissors. This is a short straight scissors. It's a suture scissors used for cutting sutures in the operating room. This is a straight mosquito used for holding on to small vessels. This is a curved mosquito, also used for holding on to vessels. This is a non-toothed forceps, helpful in taking out sutures. This is a single tooth forceps. That's what we mostly use when holding on to skin. This is a multi-toothed forceps used for holding onto cartilage and sometimes used for holding onto skin. This is a skin hook. We use it for holding onto skin atraumatically. Here's a selection of blades. This is a 15 blade used mostly by plastic surgeons. If you look at the next blade, it's a 10 blade used mostly by general surgeons to cut the skin. And finally, the last blade that I'm showing you is an 11 blade, the triangular blade, which is at the top of the screen, and that's used for cutting lips and ears in plastic surgery. I'm about to cut the skin using a 15 blade. Note that I'm holding the blade like a pencil. I am resting my hand on the patient. I cut at 45 degrees to the skin and at 90 degrees to the skin. I cut with the bevel of the blade on the patient, and I'm always resting my hand so that I do not slip at the end of my cut. Here you can see the 90 degrees to the patient. You do not skive like I just showed you, and you don't cut with the handle up in the air. Here I'm cutting with the bevel of the blade, my hand nicely sitting on the patient. I have full control when I make my incision. I'll now show you how to place a simple interrupted suture. Note my needle driver is loaded 3/8, 5/8. I grab the skin gently with my tooth forceps, drive my needle through, follow the curve of the needle, reload my needle driver without holding onto the needle, and go back through the skin. I grab the needle and pull it through. I'm now going to show you how to tie flat knots. Basically, you put a simple interrupted suture, pull it through. I think of this as an L with a long side and a short side. I go towards the long side, do a double knot, pick up the little one, take it across its flat. In the loop towards the big one, pick up the little one, take it across. In the loop towards the big one, pick up the little one, take it across. In the loop towards the big one, pick up the little one, take it across, and the knots are always flat. I'm now going to show you how to put in a figure-of-8 suture. Basically, this is two simple interrupted sutures in a row. I like the suture because it distributes the tension across the wound in two directions. Basically, it's a simple interrupted suture first. Then instead of tying it, you do another suture next to it. So throw another loop. And then you tie a flat knot. I'll now show you how to put in a running suture. Basically, you do a simple interrupted suture, just like I've shown you previously. Tie flat knots on it. Then what you do is you move down and basically place another simple interrupted suture. And then move down, place another simple interrupted suture. And as you notice that I'm not holding my needle with my hand, basically always pulling it through with my tooth forceps, locking and loading again. And then when you come to the end, you don't pull it all the way through, you leave a loop, and then basically tie flat knots. I'll now show you how to place a deep dermal suture. Start on one side, go from deep to superficial, and then from superficial to deep. You have a loop, and now you can see that the knot will be on the bottom. Basically, you tie flat knots, and you can see that the skin is perfectly opposed.